Hello everyone. Let us discuss Aphorism 3 today, which speaks to us regarding knowledge of physician. A true practitioner of healing art should possess knowledge of disease in each individual case, knowledge of medicine in each individual medicine, application of knowledge of medicine to knowledge of disease, knowledge of choice of remedy, knowledge of preparation of medicine, knowledge of dose, knowledge of potency, knowledge of repetition, knowledge of obstacles to cure, and last but not least, knowledge of prevention. So, as to make the aphorism easy, I have divided the aphorism into parts. So, part 3a will talk to us regarding knowledge of disease. So, today we will be dealing with knowledge of disease. Knowledge of disease constitutes what is disease, cause of disease, its manifestations, course, diagnosis, prognosis. And unique to homeopathy is Hahnemannian clinical classification of disease. Here we see that Hahnemann stresses the word each individual disease. Homeopathy believes in individuality. That means two individuals can never be same. Hence the diseases they suffer obviously will be different. As individuals differ in their nature, character and constitution, exactly like that, their reaction towards the external stimuli also differs. Hence, person suffers from a disease which has its own peculiarities. As we see in the practice, name of the disease remains same, means the patients do come to us with the diagnosis itself, but the cause differs from person to person, which is very important from homeopathic point of view. And also the manifestations differs. So the cause will be remaining same and the diagnosis remains same and the manifestations will differ. For example, people coming to us with diabetes mellitus. Take A, B, C as persons who may have different exciting causes which can excite the disease in them. A may get diabetes mellitus due to grief, B might get it after accident, C accidental detection where the cause cannot be traced. All these people receive different medicines from us even though diagnosis remains the same. In the same way, we can see the individuality projecting where the cause remaining same but the manifestations differ. If at all a person is getting wet in the rain, they might get cold and coryza. A might have watery discharge, B might come to us with cold and headache, fever, C might come to us with blockage of nose. So like this, different people suffer from different manifestations even though cause remains the same and receive the medicine accordingly. Knowledge of disease helps us in classification of these diseases, which in turn helps us in management of the diseases. Approach towards the case differs according to classification, which is mentioned in practical part of Organon of Medicine by Hahnemann to make our practice easy. Hence, it is important to know what is curable in each individual disease. When we go through the following chart, we understand why we have as many cases of diseases as many individuals. How and why should one consider each individual case of disease? See the chart which projects hereditary character and early environment, the reaction between these two that constitute the constitution of the individual, the emotional, intellectual and physical sphere sum total causes the constitution, and the reaction of the early environment and hereditary characters will build up the power of the disease. This I will explain in further slides. See here, there is a reaction between individual and environment. If an individual gets adopted, means that if there is a good adoption, there will be health. And if the person goes for failure to adoption, there will be symptoms on his physical sphere, intellectual sphere and his emotional sphere. And he shows withdrawal response, escape response and fighting response. We understand here that hereditary characteristics and early environment differs for each individual. Hence, a reaction between these two will give a result which is unique in nature. We see here that family history or hereditary of a person predisposes him to a particular disease according to the inferiority of end organ, tissue, or a system. In the same family, this predisposition can differ among children of the same parent. This happens due to dominance of genes, as again, both parents have different familial background for health. The sum total of individual characteristics in the three planes, emotional, intellectual, and physical, depicts the constitution. This sum total is resultant of early environmental factors right from the time of the conception, acting on the hereditary plan of the organization as determined by the genes. The finished product is so well blended that it is very often impossible to determine or separate the influence of these two factors of early environment and hereditary. A study of family history from the standpoint of the susceptibility to illness and the organization of parents is of considerable help in assessing the purely hereditary influences. A study of family setup immediately after conception, during gestation, and through infancy and childhood is of great help in determining the contribution made by the surroundings. A study of school setup and other contacts in the emotional life of the child should not be neglected. Now, disease excitation is necessarily accompanied by stress and strains. These things usually pushes patient into negativity. The various negative emotions need to be constantly molded and channelized into positive thoughts, a productive activity. This shows that a family physician or a homeopathic physician has to be friend and philosopher and guide to the patient and continuously be in touch when a patient undergoes stress and strain and get them out of their negative emotions and make them productive or make them active or stress free, which is a responsibility of a physician. Physician is responsible for healthy and happy society. The painful past experiences are not readily forgotten. This always remains in the background and has a peculiar knack of haunting us at inconvenient moments. This, however, shows that one remains always in the clutches of the past. Thus, old experiences build up a potential sufficiently powerful to influence our actions and reactions at a much later date. A study of unresolved emotional conflicts has a considerable influence on the development of the disease, especially in the emotional sphere. Hence, when somebody behaves arrogantly or somebody behaves in a particular manner, we need to go beyond and see because what it is their past through what they have gone through and how they have taken it. In that particular way, they start behaving. The constant adaptation that required in the development of an emotionally well integrated personality may fail at various stages, and this breakdown will be indicated by appropriate symptomatology, which will have to be taken care. Failure to heed these warning signs and institute proper treatment leads to personalities which cannot put into larger schema and these withdraw from unkind world of their own. This constitutes a psychotic type of response characterized by complete disintegration personality. Personalities have been able to stand stress and strain to some extent, but all the same are not able to meet the demands made on them, react through escape mechanism. This constitutes psychoneurotic response. The fighters tend to follow psychosomatic pattern in which the autonomic nervous system and endocrine system play a leading role. Thus, the study of past and present is essential for complete study of personality, without which much of the illness remains as a mystery. Thus, what we are is largely determined by what we have made of inherited traits. Thank you.